She came into my office carrying a paper bag, not a medical bag, a grocery bag. She set it down on my desk, looked me directly in the eye, and said, "Dr. Franklin, I stopped one of my blood pressure pills 3 weeks ago, not because I wanted to, because I didn't need it anymore." Now, I want to be very clear. I do not recommend stopping medication without medical supervision. But what happened next stopped me cold. I pulled up her chart. Her readings over the previous 3 weeks were the best I had seen from her in 6 years. Consistent, stable, better than when she was on the full dose. I looked inside that grocery bag, 5 items, all food, nothing exotic, nothing that required a prescription or a specialist or a trip to some specialty health store across town, just food. Specific, targeted, evidence-backed food that her body had apparently been waiting for. She was 74 years old. I'm Dr. Franklin. I have spent the better part of 2 decades working in cardiovascular medicine and preventive health. I have reviewed thousands of patient histories. I have sat through thousands of conversations about blood pressure management. And I will tell you honestly, the conversation I had that day, standing there looking into a grocery bag, changed the way I counsel every single patient I see. What I'm about to show you are the 5 foods that have the most compelling, most consistent, most clinically relevant evidence for lowering blood pressure in adults over 60. Not supplements in disguise, not powders, not pills rebranded as superfoods. Real food that you can buy, prepare, and eat starting today. Stay with me, because the last one on this list is the one that genuinely surprises everyone. And the reason it works will completely reframe how you think about your blood vessels. Before I show you the 5 foods, I need to give you a 2-minute biology lesson, because if you don't understand what's actually happening inside your arteries, these foods will seem random. Once you understand the mechanism, every single one will make perfect sense. Your blood pressure is not just a number, it is a measure of force. Specifically, the force your heart has to generate to push blood through your network of arteries and vessels. And that force is heavily influenced by one thing above almost all others: the health of your endothelium. The endothelium is the inner lining of your blood vessels, one cell layer thick, so thin you could stack 1,000 of them and barely see it with the naked eye. And yet this microscopic layer is arguably the most important tissue in your entire cardiovascular system. When your endothelium is healthy, it does something remarkable. It produces a molecule called nitric oxide. And nitric oxide is essentially your body's built-in blood pressure medication. It signals the muscular walls of your arteries to relax and expand. When those walls relax, the resistance against blood flow drops. And when resistance drops, pressure drops automatically, naturally, without a single pharmaceutical. Here's the problem. After 60, endothelial function declines. The cells produce less nitric oxide. They become more sensitive to inflammation. Years of dietary choices, oxidative stress, and hormonal changes take a toll on that one cell thick lining. And as it deteriorates, your arteries become stiffer, narrower, and less responsive. Your heart, sensing the resistance, pumps harder. The numbers on your monitor go up. Your doctor adds another medication. But here is what most people are never told. The endothelium is not a fixed structure. It is responsive. It is dynamic. It is, under the right conditions, capable of measurable recovery, even after 60, even after 70, even after decades of a diet that didn't support it. The 5 foods I'm about to show you work primarily on that endothelium. They either supply the raw materials for nitric oxide production, reduce the inflammation that disrupts it, or directly relax the vessel walls themselves. That is the game. And now that you understand it, let's play. Food 1, beetroot. Let me ask you something. When did you last eat a beet? If your answer is never or not since I was a child, or I honestly have no idea, you are leaving one of the most potent cardiovascular tools in the entire produce section completely untouched. Here is why beetroot is at the top of this list, and I mean the absolute top, not because of tradition, not because of folklore, but because the clinical evidence is some of the strongest in nutritional cardiology. Beetroot is extraordinarily rich in a compound called dietary nitrate, not the synthetic nitrate you find in processed meats, which is a separate and problematic thing. Natural, organic dietary nitrate, the kind your body was designed to process and use. When you eat beetroot, the bacteria naturally present in your saliva begin converting that dietary nitrate into something called nitrite. Then, in the slightly acidic environment of your stomach, that nitrite converts into nitric oxide. Stop and think about what I just told you. You ate a food, your own body's biology processed it, and the end product is the exact same molecule that your damaged endothelium is struggling to produce on its own. You essentially gave your arteries a backup system. A landmark study from Queen Mary University of London had participants with high blood pressure drink 250 milliliters of beetroot juice daily, roughly 1 cup. Within 24 hours, systolic blood pressure dropped by an average of nearly 8 millimeters of mercury. After 4 weeks of daily consumption, the reduction held. Endothelial function measurably improved. Arterial stiffness decreased 8 points in 24 hours from a cup of juice. That is the kind of number that makes cardiologists sit up straight. Now, how do you actually use this? Beetroot juice is the most studied form, but whole roasted beets work well too. Grated raw into salads, blended into smoothies with ginger and apple, roasted with a little olive oil, and served alongside dinner. If you find the taste challenging at first, mixing it with carrot juice or citrus softens the earthiness considerably. The one caution: beetroot can temporarily turn your urine and stool pink or red. This is completely harmless, a phenomenon called beeturia, but it startles people who don't know to expect it. Don't be alarmed, just eat less if it bothers you and work up gradually. How many of you have never tried beetroot in any form? I genuinely want to know, because after this video, that changes. Food 2, dark leafy greens, but not how you think. Everyone knows leafy greens are healthy. Spinach, kale, Swiss chard, collard greens. You've heard it 1,000 times. Eat your greens. Become background noise at this point. So, let me tell you something specific about leafy greens that you almost certainly have never heard. Something that changes them from a vague health recommendation into a precise cardiovascular tool. Leafy greens are one of the densest sources of dietary magnesium available in the food supply. And magnesium's role in blood pressure regulation is one of the most underappreciated stories in all of medicine. Here's the mechanism. Every time a smooth muscle cell in your artery wall contracts or relaxes, that movement is governed by a careful balance between two minerals. Calcium drives contraction. Magnesium drives relaxation. When that balance is correct, your arterial walls cycle between appropriate tension and appropriate release, maintaining healthy, flexible tone. When magnesium is deficient, and studies suggest that up to 70% of adults over 60 in Western countries are in some degree of magnesium insufficiency, the balance tips. The arterial muscles stay in a state of sustained contraction, more resistance, higher pressure, and a heart working harder than it needs to. A comprehensive meta-analysis published in the European Journal of Clinical Nutrition, reviewing 34 studies covering nearly 2,500 patients, found that magnesium supplementation reduced systolic blood pressure by an average of 3 to 4 points and diastolic by 2 to 3 points, and those are numbers from supplemental magnesium alone. Dietary magnesium, delivered inside whole food with all its cofactors and absorption partners, appears to work even more efficiently. But here's the specific detail I want you to carry away. It is not enough to simply eat leafy greens occasionally. The dose matters. You need approximately 2.5 to 3 cups of cooked leafy greens daily to move the needle on magnesium status. Raw greens have significantly higher volume but lower bioavailability of certain minerals due to a compound called oxalic acid. Cooking briefly, steaming, or a quick sauté breaks down the oxalic acid and liberates the magnesium for absorption. One of my patients, a 68-year-old retired engineer, was convinced he ate well because he had a salad every day for lunch, a large salad, but it was raw, and his magnesium levels were consistently low. We added 2 cups of wilted spinach to his dinner, just that. Within 6 weeks, both his blood pressure readings and his sleep quality, which is closely tied to magnesium, improved noticeably. 2 cups of cooked greens at dinner every night. That is not a dramatic lifestyle overhaul. That is a decision you make tonight. Food 3, pomegranate. I want to introduce you to a fruit that has been used medicinally across 3 continents for over 3,000 years, and that modern cardiovascular research is now confirming in ways that are genuinely remarkable. Pomegranate. Before you think of pomegranate as simply a garnish on a restaurant salad or an expensive juice you occasionally see at the supermarket, I want to show you what is happening at the molecular level inside your blood vessels when you consume it regularly. Pomegranate contains one of the highest concentrations of polyphenols found in any food that has been comprehensively studied. Specifically, a compound called punicalagin, which is found almost exclusively in pomegranate and is so bioavailable and so potent that researchers have spent decades trying to synthesize it as a pharmaceutical. They haven't succeeded. The whole fruit still does it better. Here is how punicalagin works. It is one of the most powerful natural ACE inhibitors identified in nutritional research. ACE stands for angiotensin-converting enzyme. This is the same enzyme that an entire class of commonly prescribed blood pressure medications with names ending in pril, lisinopril, ramipril, are designed to block. When this enzyme is overactive, it triggers a cascade that causes blood vessels to constrict and blood volume to increase. Block the enzyme, reduce the constriction, pressure comes down. Pomegranate does this naturally. A study published in the journal Atherosclerosis followed patients with carotid artery stenosis, a narrowing of the arteries in the neck, who consumed pomegranate juice daily for 1 year. Not only did their blood pressure drop significantly, the thickness of arterial plaque in their carotid arteries actually reduced by over 30%. Plaque that had been building for years began to recede. I want you to sit with that for a moment. Not just blood pressure reduction, actual structural improvement in the arteries in 1 year from a food. Now, practical application. Fresh pomegranate seeds are excellent, roughly half a pomegranate daily. Pomegranate juice, pure with no added sugar, works well at around 150 to 200 milliliters per day. Be aware that it has a naturally tart, intense flavor. Mixing it with sparkling water makes it far more palatable for most people and turns it into something you actually look forward to. One important caution, identical to hibiscus tea. Pomegranate has significant ACE inhibiting activity. If you are already taking an ACE inhibitor medication, please discuss this with your doctor before adding pomegranate regularly to your diet. The goal is controlled, stable management, not a sudden overcorrection. Which of you has pomegranate seeds in your fridge right now? And which of you just added them to your shopping list? Tell me below. I'm keeping track. Food 4, sardines. I'm going to ask you to stay with me on this one because I know the reaction I'm about to get and I've learned to preempt it. Sardines. Yes, sardines. Not salmon, not tuna, not a general recommendation to eat more fish, specifically sardines. And I'll tell you exactly why this specific fish earns its place on this list in a way that other fish simply do not match. After 60, one of the primary drivers of rising blood pressure is something called arterial stiffness. I mentioned it briefly earlier, but I want to go deeper here because this is where sardines become uniquely important. Arterial stiffness is measured clinically by something called pulse wave velocity. Essentially, how fast a pressure wave travels through your arterial system. The faster it travels, the stiffer the arteries, the harder the heart has to work to push against them. Omega-3 fatty acids, specifically EPA and DHA, the long-chain marine omega-3s, have the most compelling evidence of any nutritional compound for reducing arterial stiffness in older adults. Not plant-based omega-3s like flaxseed. The marine variety, EPA and DHA. Your body converts plant omega-3s very inefficiently, especially after 60. You need the preformed marine version. So, why sardines specifically over salmon? 3 reasons. First, sardines are eaten whole, including the small, soft, edible bones. Those bones are one of the richest sources of bioavailable calcium and phosphorus in the entire food supply, in the correct form and ratio for skeletal and vascular health. Second, sardines are among the lowest mercury fish available because they are small, short-lived, and eat plankton rather than other fish. They do not accumulate heavy metals the way large predatory fish do. This matters enormously for anyone eating fish multiple times per week. Third, gram for gram, sardines contain more EPA and DHA than almost any other commonly available fish. A single 100-gram serving delivers over 1,500 milligrams of combined EPA and DHA. The therapeutic target in most cardiovascular research is 1,000 to 2,000 milligrams daily. One small tin of sardines, one serving, you are there. A study in the American Journal of Hypertension found that regular consumption of EPA and DHA-rich fish reduced systolic blood pressure by 4 to 5 points on average in people with hypertension, with greater effects seen in older adults and those with higher baseline pressure. Practical application. Sardines in olive oil. drained and served on whole grain crackers with a little mustard and sliced cucumber, mashed onto sourdough toast with lemon juice and capers, stirred into a simple tomato sauce over pasta. Once you stop being apprehensive about them and start thinking of them as a flavoring ingredient rather than a standalone item, they become genuinely versatile. 2 to 3 servings per week. That is the target that the research supports. Start with one this week, just one. See how you find it prepared in a way that appeals to you. The cardiovascular benefit is substantial enough that it is worth experimenting until you find the preparation you actually enjoy. Food 5, the one that surprises everyone. I promised you one that would reframe everything. Here it is, dark chocolate. And before you dismiss this as the feel-good, permissive ending to a health video, let me show you the science, because this is not a cheat. This is not a reward for getting through the list. This is one of the most well-studied cardiovascular foods in nutritional medicine, with more than 140 randomized controlled trials investigating its effects. More clinical trials than most pharmaceutical compounds receive before approval. The active ingredient in dark chocolate is a class of compounds called cocoa flavanols, specifically epicatechin. And epicatechin does something extraordinary to the endothelium, that one-cell thick lining we talked about at the beginning. It directly stimulates the enzyme ENOS, endothelial nitric oxide synthase, the precise enzyme responsible for producing nitric oxide in your vessel walls, the same nitric oxide that relaxes arteries and reduces pressure. Epicatechin doesn't just supply nitric oxide precursors the way beetroot does, it activates the factory itself. It makes your endothelium more capable of producing its own protective molecule. A 2012 meta-analysis published in the British Medical Journal reviewed 19 randomized controlled trials and found that cocoa flavanol consumption reduced systolic blood pressure by an average of 2 to 3 points and diastolic by 1 to 2 points. That may sound modest, but at a population level, a 2-point reduction in systolic blood pressure is associated with a 10% reduction in stroke mortality. Every consistent point matters, but here is the critical detail that most people get completely wrong. The chocolate must be dark, minimum 70% cocoa. 85% or higher is better. And the reason is simple. Milk chocolate contains so much sugar and dairy that the flavanols are largely inactivated and the cardiovascular benefit is neutralized. Dutch processed cocoa, which is alkaline treated, destroys a significant percentage of the flavanols in processing. You want minimally processed, high percentage dark chocolate. Look at the ingredient label. Cocoa or cacao should be the first ingredient listed. The therapeutic dose used in most studies is between 10 and 20 grams per day. That is roughly 2 to 3 squares of a standard dark chocolate bar. This is not a license to eat chocolate freely. It is a specific, modest daily dose that delivers meaningful flavanol content without a meaningful sugar or calorie burden. One of my favorite recommendations to patients who have always believed healthy eating means deprivation. 2 squares of 85% dark chocolate after dinner. Not as a treat, as medicine. Watch their faces change, bringing it all together. Now, I want to take a step back from the science for a moment because I think there is something important to say about why this information doesn't reach more people. Why someone can spend years managing blood pressure, visiting doctors regularly, taking medications faithfully, and never once have a conversation like the one we just had. It is not because doctors don't care. The physicians I know care deeply. It's because the modern medical appointment is built around acute intervention, not slow prevention. You come in, the number's high, a prescription is adjusted, you leave. Nobody has 40 minutes to walk through the biology of the endothelium and the ACE inhibiting properties of pomegranate. That gap is real, and it has consequences for real people. The patient with the grocery bag I told you about at the beginning of this video, she hadn't been given bad medical advice. Her doctors had been competent and attentive. She had simply never been given this particular layer of information, the layer that connects what she ate to what her arteries were doing at the cellular level. Once she had that information, she acted on it methodically, consistently, over months, and her body responded exactly the way the research said it would. That is what I want for you. Not a dramatic transformation in 2 weeks, not the abandonment of any medication your doctor has prescribed, but a gradual, consistent, informed shift in what you put on your plate. One that compounds over time the way all meaningful biological change does, slowly, invisibly, and then suddenly, undeniably. Your 5 food action plan. Let me give you the clear summary. 5 foods, 5 mechanisms, 1 unified goal, food. 1. Beetroot. Half a cup of beetroot juice, or a medium-sized roasted beet several times per week working toward daily. Mechanism supplies dietary nitrate that converts directly to nitric oxide in your bloodstream, relaxing and widening arterial walls within hours of consumption. Food 2. Cooked dark leafy greens. 2 cups of cooked spinach, kale, Swiss chard, or collard greens daily. Mechanism restores magnesium levels that govern the calcium-magnesium balance in arterial muscle, allowing vessel walls to relax and reduce pressure naturally. Food 3. Pomegranate. Half a fresh pomegranate or 150 milliliters of pure pomegranate juice daily. Mechanism: punicalagin inhibits ACE enzyme activity, reducing arterial constriction through the same biological pathway as a major class of blood pressure pharmaceuticals. Food 4. Sardines. 2 to 3 servings per week minimum. Mechanism: EPA and DHA reduce arterial stiffness, lower pulse wave velocity, and have direct anti-inflammatory effects on endothelial tissue, particularly important in adults over 60. Food 5. Dark chocolate. 10 to 20 grams of 70% or higher dark chocolate daily. Mechanism: cocoa flavanols activate endothelial nitric oxide synthase, directly enhancing your blood vessel lining's ability to produce its own protective, pressure-lowering nitric oxide. Together, these 5 foods address blood pressure from 5 separate biological angles simultaneously. They are not redundant, they are complementary. Each one reinforces the others in a way that no single food or single medication can replicate alone. Now, here's what I want you to do before you close this video. Open a new note on your phone. Write down just one of these 5 foods, the one that feels most accessible, the one that requires the least change to your current shopping or cooking habits. Not all 5, just one. This week, next week add another, the week after another. By the end of the month, all 5 are in rotation, and you haven't overhauled your life. You've simply made better decisions one at a time until they became automatic. That is how every patient I've watched transform their numbers has done it. Not a dramatic overhaul, an accumulation of small, specific, consistent choices. I want to leave you with something that has stayed with me since I started doing this work. Blood pressure is often called the silent killer, and the reason it earned that name is not because it's untreatable. It is among the most treatable conditions in all of medicine. It earned that name because it is silent, because people manage it passively, reacting to numbers at appointments, adjusting medications without ever fully understanding what is happening inside their own body or what they have the power to change on their own kitchen counter. The silence is the problem, not the pressure. The patient with the grocery bag broke the silence for herself. She asked questions, she read the research, she made 5 changes, and her arteries, which had spent years thickening and stiffening against a tide of inflammation and inadequate nutrition, began slowly and measurably to respond. You now know what she knows. Your endothelium is not a fixed destination. It is a living, responsive, adaptable tissue, and every meal you eat is either a step toward better function or a step in the other direction. Tonight, you can make a different choice. Not a perfect choice, not an instant transformation, just one different choice. Start with one food on this list, make it tonight, and then come back and tell me in the comments how it went. I'm not going anywhere. I'll be here, and I genuinely want to know which of these 5 most surprised you. Which one are you planning to try first? Take care of those arteries. You cannot see them, you cannot feel them directly, and most of the time, they ask nothing from you. But quietly, every hour of every day, they are keeping you alive. Give them something worth working with. Everything shared in this video represents general health education based on current, peer-reviewed cardiovascular research and clinical experience in preventive medicine. It is not a substitute for individualized medical advice. Please do not adjust, reduce, or discontinue any prescribed medication without first consulting your physician. Bring this information to your next appointment. Have the conversation. The best outcomes I have ever seen came from patients who were engaged, informed, and working in close partnership with their medical team. Be that patient. Subscribe for evidence-based preventive health content for adults over 60. New videos every week. Share this with someone whose heart deserves better information.